While performing surgery, this female doctor fell asleep and accidentally pinched the patient's heart. However, she did not inform the lead surgeon on duty. Shortly after the surgery was successfully completed, the doctor looked at her gloved fingernails and realized that she might have injured the patient's heart. Sure enough, not long after, the patient's condition began to deteriorate. The attending doctors immediately examined the patient, but strangely, the patient's vital signs returned to normal, and no one knew the cause. The lead surgeon was confused, and eventually, the female doctor admitted that she had accidentally punctured her glove with her nail and might have torn the heart. The doctors then took the patient back into the operating room. However, upon examination, the patient's heart was found to be in good condition. Shockingly, they discovered a towel inside the patient's chest. The towel appeared to have been inside the patient's body for a long time, possibly left behind by the surgeon who operated on the patient 5 years ago. The hospital director was furious about the consecutive surgeries and wanted to find out who had operated on the patient 5 years ago. After an investigation, they discovered that the surgeon responsible for that operation was none other than the lead surgeon himself. Realizing that continuous surgeries could damage the hospital's reputation, he decided to keep the data as a lesson. However, the patient's family had hired a lawyer to sue the hospital. Faced with a lawsuit, the hospital director insisted that there should be no more lies. Eventually, the surgeon admitted his mistake in leaving the towel inside the patient 5 years ago. However, he argued that the cause of the patient's chest bleeding was due to excessive weight loss. Every doctor can make mistakes, but what matters most is taking responsibility. The hospital director admired his assistant for choosing to admit the mistake rather than cover it up. In the end, the lead surgeon of the operation was punished with a 1-month suspension.